Hey, good morning, everyone. First of all, thanks for taking time and joining our session today. Welcome to this special session from Simplify Healthcare. I'm Ramesh Padri, Vice President of Product Delivery based out of Chicago. I was in Minneapolis before. I thought I will move somewhere warmer down south, and this is where I landed, Chicago. And I have the pleasure of moderating today's discussion. We are here to talk about what it takes to support 7+ years of consistent CMS PBP submissions by Benefits1, which is a Simplify Healthcare's flagship platform, which made it possible to submit 30% of all Medicare Advantage plans nationwide. As many of you know firsthand, PBP submission is not just a regulatory requirement, right? So it is a high stakes, time sensitive, and detail intensive process. Year after year, payers go through this. Some of the daunting challenges, right? You can give a thumbs up if you agree to any of these challenges, right? As a payer that you goes through. Data inconsistencies across teams, right? It always happens, right? Each team has different data for the same benefit. And sometimes the payers go through manual spreadsheets that are highly error prone. And CMS is not helping either, right? They keep on changing their rules and regulations year over year, and that requires constant adaptation. And most of the payers are bogged down with tight timelines, and we have seen with our own eyes how payers struggle with the timelines. And there is zero error tolerance from CMS, and as payers, we all go through it. And if the PVP submissions go wrong, the impact really turns costly, right? It could be your rejected submissions. Sometimes there are compliance risks that could ripple through to your materials team, like your ANOCs and EOCs, and sometimes it impacts your star ratings and even member experience in some cases. That's why the conversation we are having today is so important to get the PVP submissions right. This is where Benefits1 platform from Simplify Healthcare plays a crucial part, designed specifically for end-to-end benefit configuration and as well as CMS bid submission. I know some of the people in the audience, you are new to Benefits1. To give a gist of what Benefits1 is, it streamlines the full cycle of benefit management, right from benefit design, configuration, validation, and all the way through your successful PBP submission. Not only that, it also enables in building materials like your typical ANOCs or EOCs and SPs. And it also integrates with your upstream systems, right? Like your actuaries or formularies, and also to your downstream systems with your marketing portals and materials production, right? So it's kind of end-to-end platform streamlining the benefits. So over the past 7 years, Benefits1 platform has supported over 30% of all PBP submissions nationally, helping health plans either reduce rework, ensure compliance, and also scale with confidence based on their submissions. So today we have great panelists here who will share how this platform has delivered results year after year, the challenges they've overcome in their journey, and what innovations lies ahead as well. And I'm joined by 3 such leaders, all of whom have spent over 7 years here at Simplify Healthcare. I did only 2 so far. I have 5 more years to go, helping payers with the PVP bid submissions. We will start maybe Tasneem, Chital, Vice President of Product. Maybe Tasneem, if you want to introduce yourself.
Yep, thank you, Ramesh. Hi, everyone. I'm Tasneem Chital, Vice President of Product on the Government Markets and Simplify Docs, and been fortunate to be here for close to a decade now with Simplify Healthcare. So, seen the journey of the product development right from the time back in the days of submitting PBPs to the desktop application, and more current now to submitting the same PBPs to the web application. And very excited and feel privileged to be a part of this panel with some of my colleagues who have been on the same journey with me.
Yeah, thanks, Tasneem. We have Rose Rasigan, Director of Product Delivery. Rose, if you want to introduce yourself, please.
Yes, thank you. Hello, everyone. Rose Rasigan. I've been with the organization here at Simplify for over 7 years, and I have worked with every single one of our Medicare clients with their at some point for their implementation and/or in production support, as well as working with any new clients that may be coming aboard. So I've seen the complete journey, and I've supported our clients throughout the years. Thank you.
Thank We have Kaustubh Barole, Senior Product Manager. Kaustubh, you want to introduce yourself, please?
Sure. Hi, everyone. This is Kaustubh Borole. I'm a senior product manager here at Simplify. I've been here for 6+ years, and all these years, mainly I've worked on the Benefits1 product and our customers to support on their bid submission process.
Thanks, Kaustubh. Hey, let's dive right into our questions, but there is a Q&A session right at the end of the session. You have the opportunity to ask any questions. And if you want to start typing your questions in the chat, please welcome to do so. Tasneem, I'll start with you, right? The focus of conversation with you is more around the strategic product foundation. Let's start with you on the big picture, right? 30% of PBP submissions nationally is not an easy feat, and we all know that. What product features and capabilities in Benefits1 is making this huge milestone possible? What did we do right, or what did we do different?
So, thank you, Ramesh. Right. So if I just trace back the journey, right, for the last 7-8 years, when we were kind of evaluating the pain points that healthcare payers are kind of going through, right, what we found that typical workflow to be is, they're working with their actuaries where they're, handed off, Excel files embedded with macros and stuff like that. They're using those to kind of key in the benefits in the PBP software, right? Then they, some of them are working separately with their pharmacy teams for prescription related data, right? They're keying that in separately in the PBP software. Some of them have these vendor files for supplemental information, largely dental, vision, hearing, and in some cases, some additional benefits, right? So you can imagine there is this, multiple Excel files. All of these changes are iteratively coming across to them, right? In multiple versions. So managing them, making sure that they're not making an error, was a lot of manual, time consuming, and an error prone approach, right? What we also found is that it's not just submitting to PBP is not the end, right? What they also had to do then with that data is they had to create Excel files from it in various formats that was suited to their downstream users, right? So the mandated materials team got one format, the core admin team got another, right? The portals team got a third. And see, some of them did have tech teams, but there was a lot of back and forth requirements, SQL procedures, right? Because as we know, CMS makes considerable changes every year to their software, right? To the benefits and such. So keeping up with all of those changes was a pretty big task, right? So when we were, when we were designing and thinking through Benefits1, right, we wanted to make sure that it's not just creating a digital source of truth and optimizing the way you're managing your benefit information, but it's typically addressing this whole end-to-end life cycle, right? All the way from upstream, all the way through downstream, right? Whether you have, actual files, whether you need all of these bulk update capabilities, advanced reporting capabilities, integration, to downstream systems. It was just kind of, making sure all of these capabilities were packaged in one, right? Now, coming to your question, how do we keep up with CMS, managing such a large volume of data from the application? I would say that, there are multiple, but 3 large platform related core capabilities, right? I think number one is that the platform has a dynamic data structure, right? What we mean by that is, the design studio, right? The product designing piece is completely business user configurable. So we actually have business analysts, which are part of Kaustubh's team here, who actually analyze all of HPMS changes, and they are the ones who are configuring these design changes directly in the application. So we have no tech intervention to create our design, right? And what the system does is it automatically whips up the user interface. It creates the reporting database at the back end, as well as the API endpoints, right? Which is why we can turn around these changes and keep up with the CMS changes that quickly, right? So our reports are ready. Of course, our user interface is ready much in advance, but our reports, right, if there are integrations, we support both upstream and downstream. All of that we are able to kind of take care of pretty quickly, right? Additionally, it's a modular application. So if your needs are genuinely creating a source of truth, with all of these bulk update capabilities and all of that, you can just go with that, right? If you wanted to plug and play with any of our other capabilities, you want to customize it to suit your workflows, all of that flexibility is there within the platform itself, right? And lastly, it's a fully scalable product, right? There's a large volume of data that is managed across our applications every single year, every single bid season. Number of syncs that we do, cascades that we run, integrations that we facilitate, right? So all of these features combined facilitate this large volume of data and keeping up with CMS regulations every single year.
Yeah, that's quite impressive, Tasneem. This proves strong foundation leads to consistent results, no doubt about it. And thanks for that response. My next question is around the regulatory cycles with CMS. We all agree regulatory cycles are growing more complex year over year, and it is not easy to manage ever-changing regulations from CMS. How do you enable future proofing with the platform, right? The Benefits1, while we still meet the immediate needs of filing teams?
Right. So from keeping up and meeting the needs of the filing team, I think one thing I will say is that we do have a team that is industry experts as well as product SMEs, right? And the team is very well versed with the way the PBP application is laid out. They are very quick to analyze and incorporate all of the changes in that, right? Additionally, what we also do is we make sure that all of the communication that is there is very tightly managed, right? So we are communicating very openly and transparently with all our clients. These are the changes, these are the release schedules that are coming up. And we have a very, very close-knit association with both CMS as well as with the clients, right? Because sometimes there are changes that CMS makes on the fly. So we've got to, make sure that that partnership with them is also pretty much established, right? And then we have a feedback loop from a product perspective that we have, established with our clients. We have user groups, we have, sync ups with them, and we are closely listening to every feedback that they are giving, to us, right? And we make sure that that feeds back into the product backlog, and they do have whatever capability they would need, right, to be successful in the next filing season itself, right? Of course, if there's a CMS change that needs us to, develop and design a capability, that is also, that is also very much done. And of course, the dynamic modular nature of the platform enables us to turn this around pretty quickly as well.
Okay, that's insightful. These regulations are a constant pain and not easy to handle, and turning around these changes pretty quickly, it's amazing. Thanks for that. My next question is around the future, right? Let's discuss what lies ahead of us. Looking ahead into 2026 and beyond, what product innovations do you believe will reshape how payers approach bid filing over the next few years?
Yeah, there's a lot of interest, in AI and what use cases, AI can solve in the payer world, right? Currently our Benefits1 platform is, already having its own, native intelligence assistance, right? Its own AI assistant, which kind of just facilitates, comparisons, smart querying and everything across the platform, right? Now, what we want to do is kind of further leverage it to kind of build the plan and benefit designer, right? Wherein we are leveraging AI as well as the CMS data that we already have access to through our insights capability, right? And to make plan and benefit recommendations real time to the user as they're building the plans within Benefits1, right? Then also there are a number of agentic AI use cases to kind of facilitate certain, manual updates and processes that we are seeing that the business user may be doing in the application. Smart dashboarding and notifications, as they are kind of working in the application. And then lastly, there's also, the use of AI in the integrations that we are kind of looking at, right? We already do have an advanced capability, from upstream as well as downstream integrations, and the way our AIs are generating as well. But this is more of, seeing how we can, make our mappings faster as well, leveraging all of these AI capabilities.
Yeah, lovely. That's more futuristic. We all agree there is no future without AI, and getting ready for the future, keeping peers in mind, it's amazing. Thanks for that. So my last question to you, what is your favorite capability in Benefits1 for PPP submission? What do you like the most?
That's a very difficult one to choose, Ramesh. But if I
Okay.
do have to make a choice, I think I'll say HPMS Sync. I think for two reasons. It's a very appropriate reminder for some of us, right? On when the CMS made that big change, when they went from desktop, to the web application, it took 2 to 3 years, I believe, right, to actually make that change. We had less than 6 months to turn that around, right? And the fact that our team worked hard and they turned that change around, and we actually had a large volume of PBPs and payers actually filing through our application that very year. It's a very proud moment, honestly, right? So I feel that for that reason, and the second is also it's another reminder of the scale and the volume that our application can handle, right? As well as the dynamic nature. So as we are able to sync every year with CMS with all of the changes that they do, and in a couple of minutes we are able to sync hundreds of plans to HPMS as well, right? So because of that, I would say that the HPMS sync is one of my favorite capabilities.
Yeah, nice. That's very much needed, syncing of with HPMS. Thanks, Tasneem. Moving on, Rose, I want to discuss with you on delivery and operations. You have been at the forefront of executing PBP submissions across different years, across many years and filing seasons. What does it take operationally to deliver accurate, on-time submissions at this scale year after year? What did we do right with the payers?
So from a Simplify Healthcare standpoint, utilizing our Benefits1 platform, we do a lot of preseason planning, right? We look at the volume surges, any edge cases, and we also developed a playbook, right? And in that playbook, we have the preparation for the next bid cycle. And as Tasneem mentioned, as HPMS releases the CMS releases the changes, our team analyzes those changes. And we also communicate them, but we communicate them in the form of release notes. So our clients can see every single change that's coming in year over year. And we communicate that out with the release notes and that type of thing, and the schedule in which it'll be implemented. So when they release those changes, we have the ability to turn them around. Say they release in the beginning of January, usually. We have them incorporated into our tool by the end of January. So from a client's perspective, operationally, it always starts out with a simple plan renewal in our tool, basically taking all of the plan data from the previous year, renewing it to the next. So their focus then is really the changes that are coming in from the HPMS changes, as well as any business decisions that are made if they're, have growth or that type of different changes. So our clients can then begin updating B1 Medicare as early as they like, meaning we don't have to wait. Clients that are utilizing B1 Medicare have access to it at all times, whereas with HPMS, that production window kicks off in April. So as they're going through their first starts out with competitive analysis, right? Determining what they want to do in the next plan year. Then if they're going through their bid pricing rounds, they can make those updates within B1 Medicare as early as possible. And utilizing our version management, they can version out each one of those pricing rounds in preparation for the bid submission. And lastly, they can submit or they can sync their information from Benefits1 as many times as they'd like to prior to that first Monday in June bid submission deadline.
Yeah. Hey, Rosa, I couldn't hear your voice properly. I'm not sure with others. You want to come closer to your system, maybe. It's a little bit choppy sometimes. Yeah. So thanks, Rose. That's excellent and quite insightful, clearly explaining, right, how the filing works in line with HPMS. A lot of preparation and planning goes behind the scenes to manage payers at different scale, right? Thank you so much, Rose. My next question is around the headwinds we all face, right? CMS, right? You constantly face headwinds during the filing seasons, working with many payers. I would like to cover some of the challenges that the Medicare Advantage plans face during the PBP submission. If you can quote some examples, that would be really helpful, what those challenges are and how Benefits1 is positioned to solve those challenges.
Absolutely. So when I look at, examples from previous years, we have I have two examples to share. I've had one large client that had basically doubled the number of PBPs they're going to offer the next plan year, right? And with our tool, the scalability is easily managed, right? So we have not only our bulk update capabilities that help, we can copy plans over. So they were easily able to manage that growth within our tool. Another example would be a large client that was expanding their membership into different regions. So that growth alone really increased their volume. Now, in both examples, the tool, utilizing our tool, made it easy to manage. What I mean by that is they didn't have to, hire additional resources to pick up those additional PBPs and volume of work. It was easily managed within our tool directly. Again, by utilizing our bulk update capabilities, being able to copy the plans over and starting the work early in our tool in preparation for the bid submission.
Yeah, thanks, Rose. Right, these are good examples, and we can take a deep dive if there are any additional questions from the participants. And yeah, and we are able to solve it with no additional resources. Respect to the amount of changes, that looks magical to me, and thanks a lot for that. My next question is around the PVP submission, right? Let's demystify the engine behind the scenes. Can you walk us through a typical PVP submission timeline using Benefits1, right, from kickoff to CMS upload? This would be helpful for payers, right, who are new to Benefits1. So what are the steps involved?
Okay, so let's talk about it from an implementation standpoint. So when we engage with a new client, the first thing we want to do is develop the source of truth. So we request the previous year's JSON files. We have a data migration capability to load all of that information directly in Benefits1. And we can validate the information by generating a JSON out of our tool and comparing it with the client's JSON file from HPMS. That's the validation that all of the plan data is in our tool successfully. Obviously, with training for the client, after that happens, it's a simple, again, renewal to the next plan year. And then the normal course of business begins. Obviously, our clients would be trained on all features within our tool, meaning the things that I've already referenced, right? Version management, our bulk update capabilities, and basically they can begin work. So they can utilize, if they have growth, they can copy plans, they can manage their changes year over year, all in preparation for that initial bid. Then again, coming back to our tool, they can version out the plans. So when the benchmark or changes come in, they simply make those updates in Benefits1 and again, sync them back up into HPMS. And then lastly, for the final bid, when those final changes are decided, the changes can be done in Benefits1. And when HPMS opens up that window, they can sync those changes back up to HPMS.
Yeah, lovely. And I appreciate the way you explained in simple terms, right? Thanks for the detailed explanation of the process in simple terms, which has worked out consistently for many years. And for some of the peers who are new to this, if you have more questions, we can definitely use the Q&A session towards the end. So Rose, my final question to you, again, what I've asked Tasneem, what is your favorite capability in Benefits1 for PBP submission? What do you like the most?
So one of the features that I think that clients resonate with as well, that I'd like to highlight is version management. So again, it really helps control that bid prep process. So as you're coming into the tool, you're renewing for the next plan year, you start on a version, you can renew the version, baseline it, if you will, for say your first pricing round, make your changes. And then when the next pricing round comes, you can version out again. Now, the version management allows you capabilities such as if there are changes that you made in the previous round that maybe leadership has decided we're no longer going to go forward with, you can roll back to the previous version. So it reduces the number of, clicks and that type of thing or edits that you have to make to your plans. So the version management really controls those rounds. And then again, as I mentioned, once you submit your initial bid, you version out the plans, and we have our versioning allows for a minor version or a major version. So the major version really locks it down. Okay, so the benefit there is once you do your initial bid, you version out to a major version, it is locked down until you create a next minor version, say for your benchmark changes, and then the process repeats. So it really allows you to control the data within the tool as well.
Okay, Yeah, thanks, Rose, for all the amazing responses. Kaustubh, you have played a key role in refining platform capabilities based on user feedback and real-world complexity. So my next question to you, Kaustubh, is most of the payers have background working with HPMS, right? For bid submission, they come with the background of HPMS. If a payer is already working with HPMS, how do they adopt to Benefits1? What are the advantages working in Benefits1? Why should the payer shift to Benefits1?
Yeah, sure. And this definitely comes a lot from new users, especially since past few years, since the HPMS new web version has been launched. Users
Mm-hmm.
had to learn that it was a complete restructure of the PBP data as well. So one key thing about Benefits1 is it mirrors the HPMS setup. So if any user has seen HPMS or has worked in HPMS, they would have the exact same experience working in Benefits1 for the data entry. So the transition is extremely smooth. So with minimum training or actually no training, user can directly view their plans and start their updates. In addition to that, the tool also has a lot of tooltips, guided workflows while they are working in the system. So it's pretty self-guided and easy to use. So that has made it easier for users to switch between HPMS and Benefits1. Mainly, users do like to work in Benefits1 because all of their bulk capabilities. It does save a lot of time working in Benefits1. And the platform also has customizable workflows, which can be tailored to the internal business processes of each business payer. So the workflow overall working in the tool makes it more relatable and manageable to individual payers working in the system.
Yeah, thanks, Kaustubh. I think that's quite a lot of advantages to leverage Benefits1. Hey, my next question is around the scale of payers, right? We have payers at different scale. I've seen payers with 1,000+ plans using Benefits1, and I've also seen payers who has less than 5 plans. So what features makes Benefits1 uniquely suited to handle CMS filings at various scales?
Mhm. Yeah, so as you mentioned, we have a wide range,
Mm-hmm.
payers from 5 to 1,000 PBPs, and the same Benefits1 platform handles all of them. So I think the key here is what Tasneem mentioned earlier, the dynamic structure. So every year when CMS publishes the guidelines, we validate the entire PBP structure. And for any updates, if payer wants to add new plans, they want to add new services based on the changes to all of their plans. All of that is supported by default. So there is no additional work in that area. Overall, we do manage 2,000+ PVPs in the system across our client base. So scalability is definitely there in terms of quite variable. Whether you're working for on 5 products or 1,000 products at a time, the amount of work doesn't increase in terms of managing that many products. So it's mainly the way the product features are designed. Few features like there are cascades, what we call it. It's a way of bulk updating several sections of the products. So there are repetitive benefits like dental, vision, hearing, which are offered in almost all of the plans. So instead of going through each and every plan, opening it, going data entry screen by screen, these cascade functionalities help to manage all of that data in one table, in one Excel file. User can upload it and all their plans get updated with this dental, vision, hearing benefits. Additionally, similarly, there is RX cascade or prescription. RX especially is a very heavy data entry section, and it's quite time consuming to update that. So
Mm-hmm.
this functionality helps to manage all of that RX data in one central location and in one go without having the need to open all the products. It updates all of the RX plans in one go. So this overall drastically reduces the time in data entry, and irrespective of the number of products, whether it's 10 or a few hundreds, the amount of work doesn't change. Same users can easily manage the scale. As Rose mentioned earlier, we have seen customers doubling their PBPs in the same year. So there was no need for additional people. The same people were able to manage that large scale with this product functionalities.
Okay. Thanks, Kaustubh. And I appreciate these bulk and mass updates, right, making payers' life much easier to manage PBP submission. My next question is more of extension to the previous question. During PBP submission cycle, speed, accuracy, and flexibility are important to all the payers, especially for enabling yearly benefit updates, automation, and audit tracking. Can you share how Benefits1 can support payers during filing?
Sure. So I'll talk about the product features which have been very helpful for the customers from start to end for their bid. To start with, there is insights. So what insight module gives is it gives access to all of the competitor data, which has the previous bids which are submitted to CMS. So users are able to see the star rating spread, the enrollment spread, the benefit data across the entire nation, and they're able to compare their benefits data with competitor plans. So that becomes a very good starting point in deciding or analyzing the year-over-year changes. So that's a very good starting point to have access to all of this information. For data entry, as I mentioned, all of these bulk capabilities just make the data updates very easier and simpler, and it reduces a lot of time, and mainly it reduces a lot of manual errors as well. Along with that, we have global updates. What global update allows is to, if there is any repetitive update which needs to be done, if you want to add a service or update a service based on the new changes across multiple plans, we can do it once and apply it to all plans using global updates. So these mainly help to avoid any kind of repetitive work in the tool. Comparatively in HPMS, we would have to open each and every plan and do it manually one by one. But Benefits1 makes it very flexible to manage them in parallel. In addition to that, one of the most used features in the platform is our reporting. The reports are very advanced and there are various kinds of reports out of the box from the system. One is, I would like to mention, the activity log report. So all the activity which is done by all users, whether it's updating the plans or any kind of other activity, when and where and why that change was made, everything is logged in the system. So that gives a good audit trail over all the activities which have been done over the past week, past month, or in this cycle. So it helps users to track all of their changes. And last but not least, the one which Tasneem mentioned, the system is integrated with HPMS. So with one click, user can select all of these plans and plans get synced to HPMS. So all the plans get validated in one go and get pushed to HPMS. So overall, I think these features help the users from start to end in the entire bid process.
Okay. Yeah, thanks, Kaustubh. I think we are slightly delayed. What is your favorite capability in Benefits1 for PBP submission? Maybe if you can keep your answer to 15 seconds, that will help.
Yeah, sure. So my personal favorite is the newest feature we have launched is the Benny. It's an AI assistant, and I feel it's pretty cool to just talk or chat with the assistant, and it has access to all of the PBP data and your documents data, and it's just very easy to get and interact all of those information, compare plans. So yeah, I think that's a very powerful tool we launched this year.
Okay. Thanks, Kaustubh. Thanks a lot for all of you for answering all the questions. The participants, audience, any questions you have, please feel free to ask right now.
So I believe the questions will have to be typed in the chat since all the participants are muted. So if you guys can, please type your questions in the chat, we'll answer them over here.
The first question, can we ask about material development in B1?
Yeah, you can ask any question you.
Yes.
Go ahead.
So, and I think that is her question, right? So from just to kind of start answering that question, our tool integrates the plan data directly into materials such as the annual notice of change, evidence of coverage, and the SB. So we do manage those year over year with clients. We can also develop other materials within our tool beyond just the mandated materials. Great, that's a great question. How is the annual notice of change year over year changes get developed? So if I'll take this one if everyone's all right with that.
Yeah, go for it.
As I mentioned, we, from an implementation standpoint, we load in the previous year's JSON files. So just looking at it from an implementation standpoint, we always have the 2 years of data. So from an annual notice of change, our tool systematically compares the plans year over year. By a simple ANOC chart processing that we have in our tool, we can do it in a bulk manner or plan by plan. It systematically compares and populates those benefit changes in an ANOC chart view so that you see what benefits have changed year over year, and you have the ability to manage the language that will appear around those cost share differences in our tool. And you can standardize that so it's consistent across your plans. So it is systematic. We have a master list that sits behind that can help standardize the language for it. And basically it's very quick and easy to manage year over year. Great question, by the way.
Okay, we still have 5 minutes. Are there any other questions that we can answer for you today?
Yeah, we need some tough questions to this panelist. Not the easy ones.
So the next question is, does the system create a PBP report like HPMS does? Kostu, do you want to take this one?
Yeah, sure. So the system actually has multiple reports. So to answer your question, yes, the system does create a PBP report like HPMS. In addition to that, basically the multiple reports we have is you can have a single report for multiple products or all your products in one Excel file. There can be a year-over-year report where the PBP information of the same products from last year to this year are shown side by side, and the differences are highlighted. So yes, the reports are there from the system with year-over-year, selected year, and differences. All these capabilities are there.
Right. And then do you also want to highlight the report builder capability as well?
Yeah, sure. So yeah, thank you for that. So the standard reports we have basically will have all the information in the system. But as we know, the PBP structure is quite huge. So the report builder capability we have, what it does is whenever there is a need to create those ad hoc reports, we have seen several of our customers generate ad hoc reports for out-of-network benefits, out-of-network notes to validate all of this information. There is a quick way in the tool where you can just select what benefits you would like and generate a report specific for that for any number of PBPs. So the report builder gives that flexibility to extract any information across all your products. Can we, I think there's a follow-up. Can we do a straight
Yes.
compare between HPMS and B1 PBP? Does the data vary between two? We can do a straight compare. We have multiple ways of doing a compare actually. So the reports can be compared as we have kept the structure same as PBP, as that's needed for our API submissions as well. So yes, the reports can be compared. Along with that, the JSONs which export from HPMS and our system, we have JSON compare tool as well, which compares the entire data. These are just additional ways to make sure the data in the Benefits1 and HPMS are completely in sync. So yeah, this we won't even have to, users don't even have to compare each report manually. There are ways to generate JSONs for all plans from HPMS and Benefits1, and it gives a complete compare report.
Awesome. We really do appreciate the questions.
Yeah, these are good questions. Thanks, Amanda. So anybody has any other questions? Yeah, I think there are no other questions, I believe. Yeah, you can still reach out to us, and thank you to all our panelists for sharing some valuable insights into the engine behind the 30% of Medicare PBP submissions for the past 7 years. To our audience, thank you for your time and engagement. I know you're all busy in your day work, and appreciate you taking time today. We hope you are walking away with some clear picture of what it really takes to deliver a successful PBP submission, and why a strategic platform partnership like Benefits1 matters more than ever. If you have any further questions, feel free to reach out to us, the Simplify Healthcare team, or to our panelists. And thanks once again, and we look forward to seeing you at future discussions. Thanks everyone for your time. Appreciate it.
Thank you.
Thanks,
Thank you,
everyone.
everyone.